What actually happens inside your brain when you use marijuana? Not the myths, the real neuroscience. Because the moment THC enters your body, it doesn't just relax you, it hijacks one of the most important communication systems your brain has. THC interacts with your endocannabinoid system, a natural network your brain uses to regulate memory, emotions, coordination, judgment, and even your sense of time. But THC doesn't just activate this system, it overwhelms it. Short-term effects. What happens immediately? Acute use. Mood and sensations. You might feel euphoria, relaxation, heightened senses, or a distorted sense of time. But for some people, that same surge can trigger anxiety, paranoia, panic, or fear. Cognition. Your concentration drops, your working memory becomes unstable, reaction time slows, learning becomes harder, and decision-making becomes less reliable. Motor skills. Coordination weakens, balance declines, and your movements become slower. Physical effects. Increased heart rate, intense hunger, dry mouth, dizziness, and sleepiness. This is your brain trying to function while being chemically flooded. Long-term effects. What happens with frequent or heavy use? Cognitive impact. Chronic THC exposure can create lasting damage to memory, focus, attention, and problem-solving ability. Brain development. In teenagers, the effects are even stronger. THC interferes with synaptic pruning and white matter development, processes crucial for intelligence, learning, and emotional regulation. Mental health risks. Long-term use increases the risk of anxiety, depression, psychosis, and even schizophrenia, especially in genetically vulnerable individuals. Addiction potential. Yes, cannabis can become addictive, leading to cannabis use disorder, a pattern of compulsive, harmful use. How it actually works inside the brain. THC mimics your brain's natural endocannabinoids, the chemicals that regulate mood, memory, and pain. But instead of gently tuning the system the way your brain intends, THC overstimulates it, disrupting normal communication between neurons and altering how different brain regions talk to each other. What changes the effects? THC potency. Higher THC equals sharper, stronger effects. Age of first use. Starting young dramatically increases brain development risks. Frequency and dose. Daily use carries far more risk than occasional use. Mixing substances. Combining marijuana with alcohol or tobacco amplifies negative effects. The bottom line? Marijuana doesn't affect everyone the same way, but it always affects the brain. And understanding the neuroscience behind it is the first step toward making informed decisions about your health. If you want more science-backed videos explaining the human body, the brain, and how substances affect your health, hit like, drop a comment, and subscribe, and keep learning what's really happening inside you.